So what kind of pain were you having?
Initially what brought me to Dr. Parton is my neck problem. I woke up one day and due to some things I was doing with weights and not getting enough sleep and stressing out over a party I was having, my neck became completely locked up, couldn't move it, couldn't turn it. And so I came here to see Dr. Barton, and within 1 week's time I was better, and I thought, well, if he made my neck better, then maybe he can fix my lower back. And so I said, I mentioned it to him one day and decided to start some lower back therapy. And so we did the physical therapy, the massage, and the different therapies that he has here. And decided after some weeks of therapy to go ahead and get an MRI to see what was really going on there. And found that I had a decompressed L5 disc. And decided then to go through with the DRX 9000 therapy. And after the therapy was over, I continued to see him, I guess, once a month, and tapered off to where now, 2 years later, I'm normal. I feel normal. I do have some limits with not doing really high impact exercising. But I was taught all that here, and very thankful that I came here for that therapy. I used to not be able to brush my teeth without pain, lower back pain, and now I can. So, and that's really important to me.
How long had you had the low back pain?
It had started 13 years ago when I was pregnant with my son. I had tripped during workout class over a step and sprained my lower back. And at that time I had received, went through TIRR, physical therapy only, and wasn't able to get an MRI or an X-ray of any kind because of the pregnancy. So they diagnosed that as a sprain. And it got better enough, but it never went away. It was something I just thought I had to live with forever.
And were you referred here?
No, I found Dr. Barton in probably an unusual way. When at the time that my neck was locked up, I got on my United Healthcare website and I started going down the list of, I believe it was orthopedic surgeons, to go have my neck checked out. And nobody could get me in. And one of the providers that I called gave me his phone number. And so I walked in the door that day, they got me in that day, and I was better in a week.
So how has your experience been here?
Oh, it's been great. I've referred a lot of people here because the staff, Dr. Barton and his staff, are very professional. They take care of you. They teach you how to live with problems that you may have. They teach you exercises and therapy so that you can live normally. And I keep coming back with my children and other friends of mine. And I believe many people feel better because of coming here.
Hello, I'm Dr. Robert Barton. I wanted to say a few things about Mrs. Babb. Thank you very much, Ms. Babb. You said very kind words about us, and we really appreciate that, no doubt about it. Ms. Babb had a particular situation in the sense, actually it's a very common situation in the sense that she had been to many different doctors and many different providers. She had had consults with surgeons, pain management doctors, hypnotists, acupuncture, and really what her problem was she had a herniated disc that was putting pressure on a nerve in her back, and that disc needed to be treated the way that it needed to be treated. And how we treat that is with spinal decompression. We actually pull pressure off that disc and allow the disc to begin to mend. Without the pressure reduction or pressure release off the disc, it doesn't have very much opportunity to mend. She has been able to achieve excellent results and then has maintained those results over a period of about 3 years, which is actually a pretty good length of time. I don't see her very often in the office anymore, probably 2 to 3 times a year, and she's been able to maintain on her own in terms of doing exercises at home and that type of thing for this length of time. I think that the main point to make about this case, and it's actually a very common story that we hear in terms of exhausting so many different types of treatment and not having success. I think she also mentioned the fact that, you know, she's enjoying her life to a very high level at this point, playing golf multiple times a week and walking her dog. And, you know, life's too short to live in pain and suffer. She did not receive anything basically that would help from the other providers that she had been going to. The injections are only temporary. Surgery in terms of the fusion type surgery is a very drastic thing to do and not always necessary. So very thankful to have been able to help Ms. Babb in the way that we have, and thank you very much, Ms. Babb, for saying the very kind things about us that you have said.